Friends and colleagues, today again I'd like to talk about another important topic which is very important for uh, part 1, part 2, PCS exam and any entrance exam of internal medicine. This is hemochromatosis. What is hemochromatosis? Hemochromatosis means excessive iron depositions in the different part of our body which damage that involve organ and gives rise to sign and symptoms. So it is two type, primary and secondary. Primary means hereditary hemochromatosis, and secondary it is due to um, breakdowns of RBC repeated because of hemolytic anemia. So, for example, beta thalassemia, hemosiderosis, any other hemolytic anemia, or excessive iron deposition due to excessive iron accumulation due to repeated blood transfusions or repeated iron injection. Another cause is porphyria cutanea tarda. So today my discussion topic is hereditary hemochromatosis, which is very important. So I'd like to discuss about the sign symptoms and what examiner like to ask in examination. We'd like to discuss that. So hereditary, prefix hereditary means I told that if any hereditary or any familial means generally autosomal dominant, but there are some exception. This one exception. So this hereditary hemochromatosis is actually autosomal recessive condition. And another exceptional it is prefix is familial. I already mentioned in another video, that is familial Mediterranean fever, it is autosomal recessive. So this hemochromatosis, hereditary hemochromatosis, that primary hemochromatosis is autosomal recessive. So there is a mutation on the chromosome. So which chromosome involved? Chromosome 6. Just remember, in exam they will ask hereditary hemochromatosis, the gene mutation present in the chromosome 6, 7, 8, 9. Your answer will be chromosome 6. Then which gene actually involved? So just remember HFE gene. It is very difficult to remember together when you will remember all the disease. So just for remembering, just remember H for hereditary and Fe ferrous iron. So HFE, hereditary ferrous iron. So this gene is hereditary ferrous gene, HFE gene. So protein will be HFE protein. Where is the mutation usually? Mutation occurs in some position 282 position, and tyrosine is replaced by cysteine. For that reason it is written like C282Y, Y for tyrosine. Another mutations also occur in another position, that is 63 position, HD63. So H, you just remember high, because 6 is higher than 3, 63, and 3, D for double of 3 is 6, which is high. So high will be beside H, and 3 will be beside double D. So H 63D, 90% cases this type of mutations occur. Okay, so just you may ask in questions as which part of the protein, HFE protein, is mutated, and which is common around 90% is C282Y and another H63D. So what happened actually? It is more common in European people, 1 in 200 people, and more common in Caucasian usually. That is, in 10% you will get one hereditary hemochromatosis. For that reason, it is very very common in exam, especially Mrcp, because you need to know that it is a common disease, and you need to know, and you have to uh, have very good conception about that disease. Okay, so what happened, the mutations of HFE gene produce mutated protein HFE. So what is the function of HFE protein? This protein combined with transferrin and iron in the duodenum, the crypt, and the epithelium crypt, which regulate the iron absorption. So any mutation of HFE gene cause loss of iron regulation. For that reason, iron is more absorbed from the duodenum and deposited in the different part of the organ, and it causes the damage of that organ. So which organ actually involved? Liver, pancreas, endocrine gland like pituitary gland, testis, skin, joint, heart. Just remember these organs. So when it deposited in the liver, what will cause? It damage the liver parenchyma, which lead to cirrhosis. So initially, when it started deposition, it will be a very less amount of iron. For that reason, liver function will be damaged. But when it progresses day by day, it damages the hepatic parenchyma and leading to cirrhosis of the liver. So you will get signs symptoms of chronic liver disease, that is cirrhosis of the liver, including ascites, stigmata of cirrhosis. You will get all the symptoms. Okay. Then it deposited in the beta cell of pancreas. So what will happen? It will damage the beta cell. So there will be less insulin production and diabetes. It will deposit it in the pituitary gland, so which lead to hypogonadotropic hypogonadism. For that reason, patient will complain about a problem in his sexual life, that is impotency, and sexual desire will lost, testicular atrophy will be there. So patient will develop all the symptoms of sexual drive will be lost, and then patient will complain that I don't have, maybe in scenario they will say that the partner is complaining about his sexual performance, like that. It can deposit it in the joint and cause pseudo gout. So there will be chondrocalcinosis in the joint. It can deposit it in the heart. So it will cause dilated cardiomyopathy. So what type of cardiomyopathy will develop in hemochromatosis, hereditary hemochromatosis? You have to say dilated cardiomyopathy, because they can say that it is a restrictive type of cardiomyopathy, dilated cardiomyopathy, or other type of cardiomyopathy. Your answer will be dilated cardiomyopathy. So this dilated cardiomyopathy can lead to heart failure, and it can lead to arrhythmia. So most of the patient death is due to this cardiac failure. Okay. Patient may I already mentioned that they develop diabetes. So a patient may present with fatigue, so and joint pain due to pseudo gout. So this type of presentation, in the skin there will be depositions of the melanin, so there will be skin change. This is called bronze color, and this diabetes called bronze diabetes. So if patient is having arthritis problem in the cardiac arrhythmia or cardiomyopathy or diabetes with cirrhosis of the liver with importance, you may think that this patient is having hereditary hemochromatosis. Now, there are some questions like that. What are the reversible condition in case of hereditary hemochromatosis if treated earlier? Okay. So, if treated earlier, reversible condition is the skin and dilated cardiomyopathy. This is the uh, question you have to remember. They may ask the reversible conditions of hereditary hemochromatosis. Irreversible, before developing cirrhosis, if we treat the patient, then it may not develop cirrhosis, but after development of cirrhosis, it is not reversible. Diabetes is not reversible. Joint pain is not reversible. Hypogonadotropic hypogonadism is not reversible. So, what condition reversible, what conditions are not reversible is very important for exam context. Now, another question you will ask that how will screen this patient in the general population and the family. So, general population, your answer will be transferrin saturation and ferritin level. But transferrin saturation is more reliable than ferritin because initially ferritin level will not be so high. For that reason, transferrin saturation, your answer will be transferrin saturation if there is ferritin and transferrin saturation together. If there is a transferrin saturation not available, then your answer will be ferritin. Okay, this is for general screening. But in family, your answer will be genetic analysis of HFE gene. Okay. Now, the patient, what age actually developed? That iron absorbed day by day and deposited in the organ, and sign symptoms usually come after 40 years of age in case of male. But in case of female, there is another question: the whether female are protective or not. Because of the menstrual blood loss, there will be iron loss of the patient. For that reason, they are protective in their reproductive age. But after cessation of menstruation, male and female affected equally. Just remember this. Okay. Now, what will be the investigation? Investigation, already we mentioned that we'll do transferrin level, iron level and ferritin level. Iron level will be increased obviously because it is deposited in the blood, excessive iron in the different organ, so it will be increased. Transferrin saturation will be high. So in case of male, just remember 5 and its multiplication. Male more than 55%. In case of female, more than 50%. So female 50%, male 55%. And what will be the ferritin level? Ferritin level more than 500 microgram per liter. So all, just remember 5 and its multiplication: 55, 50, 500, ferritin 500. TIBC, it will be decreased. That means saturation will be more than 70%. If you find that the ferritin level more than 1000 microgram per liter, then you need the liver biopsy, and it is the gold standard test. And liver biopsy usually do by pulse stain, which can quantify the deposit iron amount, at the same time the degree of cirrhosis. Okay, so it is the gold standard investigation for hereditary hemochromatosis. Obviously, you need also HFE gene testing and other tests due to the complication. For example, liver function test. Uh, for heart, you need ECG to see arrhythmia, echocardiography, cardiomyopathy. For joint X-ray, of joint, you will see that um, chondrocalcilosis. For diabetes, you need to see fasting blood glucose level and sex hormone level to see the hypogonadotropic hypogonadism present or not. So these are the investigation. Now another question usually come: who will be the candidate for screening test for genetic screening test? Okay. So if any person having family history, you need HFE gene testing. If there is no family history, then if transferrin saturation more than 45 and ferritin level in case of male more than 300 microgram per liter and in case of female more than 200 microgram per liter, you need screening test and genetic analysis of HFE gene. Okay. What will be the treatment? So treatment will be venesection. Here also you just remember 500 milliliter blood, that venesection in each session twice in a week until the ferritin level will be less than 50 microgram per liter and transferrin saturation will be less than 50%. So here 50 for transferrin saturation, 50 for ferritin and 500 for blood venesection. So after that, when this level transferrin will be 50 and ferritin level of the 50 microgram per liter, your target will be this, and in per yearly 3 to 4 times you can do venesection. This is the treatment. If anybody intolerant to venesection, then desforexamine, that is iron chelating injection, can be given. Please don't prescribe vitamin C, because vitamin C is responsible for iron absorption, increased iron absorption in the stomach, in the duodenum. For that reason, please don't prescribe vitamin C. And if there is liver failure, patient may need a liver transplantation. For diabetes, you just treat for diabetes. Cardiomyopathy, you just treat accordingly for heart failure. And for genetic problem, you just refer to geneticist for counseling. And for problem in the impotency, you can refer to endocrinologist. What will be the complication? The patient will develop cirrhosis of the liver, which may lead to all the complication of the cirrhosis, and this cirrhosis can lead to hepatocellular carcinoma. The chance sometimes increase 200-fold. Somewhere it is called that the 30% increase of developing cirrhosis to hepatocellular carcinoma. And cardiomyopathy lead to heart failure. These are the complications. So what I discuss about hereditary hemochromatosis, this is actually bone diabetes. Is one cause of the chondrocalcilosis, that is pseudo gout. It can cause cirrhosis of the liver. It can cause hypogonadotropic hypogonadism. So patient may present with fatigue, impotency, diabetes, joint pain, skin pigmentation, and heart failure. This type of presentation can present in hemochromatosis. So just remember this what I discussed. I think you will get all the questions related to hereditary hemochromatosis. My next video will be on another hot topic. Please stay with me, subscribe my channel. I'll be coming very soon with another video. Thank you very much, my dear friend. Thank you.